This voiceover is going to talk about just a few conditions that result in alteration of neurologic function in children, and these are fairly common that we may see in the pediatric world. So cerebral palsy is a syndrome, really, that encompasses diseases or conditions that result in movement and posture development disorders. What's important to remember about cerebral palsy is that it is non-progressive. So the insult or injury occurs, but doesn't continue to worsen. So the damage incurred happens once. How it changes in its presentation depends on the growth and development of the child and what area has been affected. They can have associated hearing, vision, communication problems, cognitive problems, behavioral problems, lots of different types of dysfunction and complications. What often happens is that these young infants, if it occurs in the infancy stage or in that fetal development, neonatal development stage, is that in some way, form, or fashion, the infant suffers a lack of oxygen. And a lack of oxygen results obviously in a lack of oxygen blood flow to the brain, which then causes these complications as a result of those portions of the brain essentially, quote unquote, for lack of a better term, dying off. There are 4 types of motor dysfunction seen. You don't need to worry about what those 4 different types are, but they are all related in some way to where the insult in the brain took place. So a majority of the cases occur during that prenatal and perinatal period, as I said, and you see low birth weight, placental anomalies, respiratory distress, and all of those conditions listed can be associated with a lack of oxygen and a lack of blood flow of oxygen to the brain. Postnatally, or in young children and older children, we see it as a result of disease processes such as meningitis, encephalitis, or some sort of traumatic brain injury. Again, the brain suffers a lack of oxygen and blood flow. So how will the child present? It really depends on where the injury is, but there will be abnormal muscle tone and a lack of coordination in the child. Depending on the age of the child and their developmental capabilities that are expected at that age bracket, our signs and symptoms will present themselves based on that. So it does depend on what extremities are involved. So a diplegia is both legs are affected. Hemiplegia is one side of the body is involved. Usually the arm is more severely affected than the leg. And quadriplegia is all 4 extremities. But all children with cerebral palsy will have impaired motor movement, often with spasticity. Most commonly seen is spasticity even more than dystonia or ataxia. Usually they will not reach their developmental milestones. They may have some functional consequences that become more apparent and become more of a deficit as the child grows, and they require that function. Remember, though, that the disease to the brain is non-progressive, or the injury to the brain is non-progressive. So it's not that the injury is getting worse, it's that the child is growing and developing, and we're noting complications later on that would not have been there because of the growth and development of the child. Feeding also is really difficult with these kids, potentially because of oral development involvement, and we need to think about the risk for aspiration in this and failure to thrive. So treatment really just focuses on supporting the child and limiting any long-term complications. We want to help them become as independent and capable of managing their daily lives and activities of daily living as possible. So this can involve a myriad of different types of interventions. We will use lots of different support mechanisms to promote mobility in these children. Often they will be getting PT and OT and speech therapy. Sometimes due to muscle spasticity, we will develop contractures in certain areas, and surgery may be needed to improve the function in those joints where contractions have developed. Medications are also used to treat seizures that may be a problem, muscle spasms, and we can use several different types of medications, benzos, skeletal muscle relaxants, and baclofen, most often given in the form of a baclofen pump, if at all possible. I have a picture there on that slide. And the pump is placed under the surface of the skin in the abdomen, and through a tubing, baclofen is administered through the spinal column to provide muscle relaxation. And it's done so in a much more level fashion than if we were doing oral medication dosing. And these are often being used in children rather successfully, especially those that have severe spasticity issues. So injuries to the neurologic system, and in particular, we're just talking about traumatic brain injuries and concussions. Traumatic brain injuries, how children get them is really dependent on the age, but most commonly 0 to 2 years is usually from falls, maybe out a window or down the steps. Children 2 to 12 years of age, it's usually also falls or being struck with either an object or against an object. And finally, children in that adolescent or age group are through assaults, sports injuries, very common, and motor vehicle accidents. So what do we see clinically as traumatic brain injuries? If it's mild in the form of a concussion, they may remain conscious, or they may have a brief loss of consciousness. Moderate, they lose consciousness for at least 5 to 10 minutes or more. And both of these types of TBIs may have amnesia about the event, nausea and vomiting, and headache associated with it. One thing to bear in mind where TBIs come into play with infants is shaken baby syndrome. These infants may arrive to the ER, be failure to thrive, have respiratory compromise, maybe in a coma, just don't overall look right. And we need to keep in our minds the possibility that this could be shaken baby syndrome. The infants, remember, have a large head and a relatively weak neck muscles, and so that makes them much more likely to have inertial injuries as a result of that shaking. And these are just some pictures of what happens for shaken baby syndrome, the kinds of injuries that can occur, as well as concussive types of injuries. So traumatic brain injuries can be broken into concussions, as we've said, which oftentimes has a loss of consciousness, not always, but is associated with headaches. These are resolvable using post-concussive disorder treatment. Or concussive disorder treatment. Subdural hemorrhage is between the dura and the arachnoid membrane, and epidural hemorrhages, which can also occur between the skull and the dura, and that picture shows you sort of the difference in where they may be. So concussions is the really important topic that we need to think about today, especially as we are learning more and more about post-concussive disorders. More and more are being discussed in some of our pro athletes. Concussion starts out really as a mild TBI caused by a direct blow of some sort, and we often associate these with sports injuries, although they can certainly occur with other activities that we may be involved in. The blow causes a stretching and a bruising of the brain tissue, and then that has an impact on how well nerve transmissions take place in the brain and to the rest of the body. There is a rapid onset of short-term functional impairment, and it may or may not involve a loss of consciousness and cognitive, physical, emotional, and sleep symptoms. So all of those can be affected. Depending on how severe the injury is, it will determine just what kinds of signs and symptoms we see and how long those signs and symptoms stick around. They can go from just a few minutes all the way to several months. Pediatric concussive syndrome is thought to be due to an injury to the brainstem, and it occurs in children that are younger than 3 years of age. So pediatric concussive syndrome would be 3 and under. So treatment is supportive. If the child is unconscious for less than or greater than 5 minutes, or has amnesia of the event, they may be admitted to the hospital for a short stay for us to monitor them and make sure there are no other complications or bleeds. In terms of treatment, all cognitive activities are limited in the first few days after the injury and may be re-added back in as the child is able to tolerate them. And again, that depends on the severity of the injury. But these cognitive activity limitations do include time out of school, excused activities at school, whether it's test taking or some sort of learning activities that may involve videos, computer usage. This also includes those types of activities at home, so video games and watching TV. Before the child is allowed to return to an organized sport, they do need to be symptom-free and using no analgesia for headaches. So that needs to be evaluated and verified. Symptoms will usually disappear within several weeks, but in some patients can last up to 6 months at a time. And we have a lot of specialized programs now for concussion treatment, especially concussion treatment in children. Repetitive concussions is a very grave concern, and that is what often leads us to that post-concussive disorder. The last thing I do want to touch on is hypoxic ischemic brain injuries caused by drowning. And it really is caused by a respiratory compromise that results from some sort of immersion or submersion in a liquid, water most often. A submersion injury is a term that is used when a child is submerged in water but does not die. They will survive. So in young children, drowning is most associated with bathing and falling into pool water. Older children, it's most likely the drowning will occur in open water and is oftentimes associated with risk-taking behaviors, alcohol usage, drug usage, or potentially a seizure event. We need to remember that we only need about or a small amount of water that just covers the nose and mouth, and that is all we need to create a drowning event. When we have anoxia, the anoxia that results from drowning and breathing in water essentially into the respiratory system, cerebral edema occurs, increased intracranial pressure occurs, and we get secondary cerebral injuries as a result of that. While children may survive with aggressive CPR and intervention, there is most often, neurologic impairment. Not always. We have heard stories of those that have not, but there are neurologic impairments many times associated with these kids. It is imperative that we teach water safety and pool safety for caregivers and children and adolescents, especially those that may have a pool in their backyards. There are a lot of public programs now based on this, often through people that have experienced terrible outcomes as a result of drowning of their own children. I believe the skier Bodie Miller, Olympic skier, just about a year ago lost his 2-year-old daughter to drowning in their family pool, and now they have become very, very involved in safety around pools, teaching families how to deal with that. So there's a lot of resources out there, but we need to make sure families are connected in with them.